Okay, so our first treatment area, we're going to look at the perioral area. So we're going to use a combination of our 10 millimeter threads and the 30 millimeter threads. So what we're going to try and do, we're going to try and pop our 10 millimeter threads into the lip margin, and we'll pop some 10 millimeter threads coming up perpendicularly into the ergotrid. We should be able to fit 30 threads into this section doing that, and then we'll follow that up with 20 of the 30 millimeter threads doing a crosshatch across the ergotrid, and we should be able to do some in the lower, just below the lower lip as well. Alright, so now with the monos, always be mindful the actual thread is folded in half and doesn't actually go all the way down to the hub. So in this particular thread, I don't know if you can see, it's only that little section there, so it's only about 5 or 6 millimeters of thread there. So but the needle itself is that long, so where we want to place the thread, you've got to measure back to that point, which is where the needle goes in. Alright, ready? So this is just along the lip margin. And we're just going to do a row of these just along there. Now the next one, we know that the first thread only goes to about here, so we're going to come back, we're just going to try and overlap a little bit, and so we're going to come back about 4 millimeters back from the first entry hole. So we've got a little bit of overlap. Just be careful of your depth, we're just in the superficial skin. Just be careful taking the 10s out, because sometimes you can pull the little foam piece off. Okay, so we have 5. Okay, So we've done 20. Now we're going to do some vertical threads. So I've got to use 2 because what we've done, we've gone to the top of the Cupid's bow on each side, but we haven't done the center. So we're going to do those. So measuring, going back. Now there's nothing stopping you from doubling up, for example. You can put 2 rows of monos if you like. Don't have to do 1, we're just showing you the technique, and you could certainly concentrate all of your threads into that section. And now we're going to do some vertical threads. So we'll pop 1 start, we'll pop 1 into the philtrum. Our patient doesn't really have a lot of lines, but you could potentially just, if you've got somebody with a lot of lines, you could just concentrate on those lines. Okay, so we're now going to do our 30s. So that's a 33 centimeter needle. It's a 25 millimeter thread, so you can see the actual thread's folded in half. So it's cleared the end of the needle by about 10 millimeters. So again, what we're going to try and do, we're going to try and now go parallel to the margin. By doing a mesh arrangement of the threads where they're doing this, you're actually tightening in 2 directions, so you're actually compressing. Because as you know, if you've got threads in parallel, they're going to be tightening this way. All right, so they don't tighten in the direction of the thread. They tighten perpendicular to the thread. Okay, so we're going to start with our 30s. We're going to aim for 5 on each side of the cutaneous lip. So 5 there, 5 there, 5 there, 5 there. And that combined with the 30 10 millimeter threads that we put in, that's your 50 for the lip and perioral area. So we've got our 20 threads that we've put of the 30 mil needles. We're just going to, I've left them in. You can either put them, insert and then remove straight away, or insert, leave them in and then take them out after a few minutes. So the benefit of doing the latter is that, look, if you've gone through any vessels, you've given a chance for a little clot to start forming, and so once you take out the needle, then there should hopefully be less bleeding. But you know, it also depends on the amount of crowding that you're going to get with the hubs. So it does partly depend on the area. If you've got a bigger area, you can certainly leave them in. For example, the neck and the lower face, even around the eyes, you can potentially just leave them in. I've just taken them out here on the lip because they will sort of crowd into each other. All right, so we're just going to try and remove our needles now.